My name is Denise DiCicco, and I'm the Lactation Services Coordinator here at Henrico Doctors Hospital on the Forest campus. In order to be successful with breastfeeding, there's a couple of tips that might come in handy. So the first is to get information early. There are a lot of breastfeeding books, breastfeeding guides, classes that you can take. The best thing to do is to make sure that you are starting early and getting appropriate information. Books that are written by formula companies or other entities might have a hidden agenda, and so you really do want to get information from either the American Academy of Pediatrics, your healthcare provider, or your lactation consultant. Other things that can help you is to attend a breastfeeding class, and we hold ours here every month where you can meet and talk to a lactation consultant. We have an outpatient lactation center where you can come for a prenatal lactation visit if you prefer to have a one-to-one, as well as opportunities to be able to call as often as you need and speak to someone who can help you during the time that you're here in the hospital. One of the things that we would recommend is keeping your baby with you. The best way to know about your baby and to learn about your baby's behavior and hunger cues is to keep the baby with you. So when your baby gets hungry, your baby starts acting hungry, the best thing to do is to feed your baby, and the more practice you get while you're here, that's really what's going to help increase your confidence and your comfort level for when you go home. While you're here in the hospital, it's also very important to make sure that you are avoiding pacifiers and bottles, which may contribute to a baby's lack of interest at the breast. Some babies are very happy to sleep through their feedings, but we really do want them to wake up in response to hunger. Remember, your baby has been a fetus all of their lives, and they don't necessarily know what hunger is. So sometimes a gentle prodding can be quite helpful. After you go home, it's important to keep up some of the practice sessions that you have had here at the hospital. I call them practice sessions because sometimes if we consider them feedings and the baby sleeps through the feeding, you might be tempted to provide another type of supplementation for your baby. So consider these practice sessions. It takes about a good 3 to 4 weeks for moms and babies to really get into the stride of breastfeeding. So things that you might want to consider is practicing all the different positions that you practiced while you were here in the hospital, because sometimes the baby might want to nurse in one position, maybe not in the other. So it's good to have more than one option to pick from. That log that we gave you here in the hospital is a good way for you to keep track of your feedings so that you can see if you're a little bit behind of the feedings or if you're a little bit ahead, and how you might have to adjust the course so that you are meeting that goal of 8 to 12 feedings a day. Remember too that your healthcare provider, pediatrician, obstetrician, lactation consultant are all here to make sure that you are having a successful experience. So make sure that you ask for help early if you need it. A lot easier to be sure to fix a problem before it starts to affect your confidence or your milk supply or your success in breastfeeding.